What we're going to look at today is Medicare, because it is insurance. Most people know that insurance for the elderly, but we wanted to explain a little bit more about what goes into Medicare and why it's important, what the important distinctions are. So Medicare is a federal system of health insurance. You get this taken out of your paycheck every month. You pay for it. Eventually, when you turn 65 years or older, you get this type of medical coverage. And there's two main parts that go into Medicare: Medicare Part A and Part B. We're going to talk about Medicare Part A first. So what is Part A? This is what your taxes pay for. If you pay at least 10 years worth of Social Security and related taxes, you get this for free when you turn 65 or older. It helps cover hospital stays. That's the important part. Medicare Part A equals hospitals. Then there's Medicare Part B, which is the medical insurance part that covers things like doctor's visits. So Part B equals doctor's visits, and you pay a premium for this. So it gets deducted from, say, your Social Security check, and that's the important part, Mark. So those are the two main parts of Medicare.
Let's get a little bit more complicated depending on the type of coverage you want, right?
Well, it does, because there's two other main parts to it. There's Part C and there's Part D. We'll go to Part D first, because D stands for drugs. If you have prescription drugs, you oftentimes sign up for something called Medicare Part D. This covers the cost of prescription medications, and it's typically offered through private insurance companies. That's the important part. You have to sign up with a private insurance company like a United Healthcare or a Humana or Cigna, and they provide this coverage. The one that gets interesting here is Medicare Part C. It's also known as Medicare Advantage. This is also offered through private health insurance companies. And with these particular motions here, with Medicare Part C, you get the same benefits as Medicare Part A, Medicare Part B, and Medicare Part D. So that's hospital stays, doctor's visits, and drugs, except you sign up and pay premiums through a private insurance company. Now, the reason why we're talking about it is because earlier on this past week, a lot of these health insurers took large stock hits after the U.S. government said that they may not reimburse as much money to companies like Humana, United Healthcare, and Cigna for that type of coverage. So Medicare Part C, Mark, equals Medicare Advantage. Those are the A, B, C's, and D's of Medicare.